take from my bed to the floor. 5, 6, 7, 8. Will today be rough or will today be great? 9, 10, 11, 12. Lately I've been going through hell. 13, 14, 15, 16. Today's the day. Are you coming? Are you sick of being normal? I'm sick of being average. I'm sick of being mortal. I'm about to be a savage. I see a lot of things that I want, I will have them. I got a new mindset that I just established. I'll march through the cold with the nails on the pavement. I'll shovel that coal just to get out the basement. My story will be told, helping others make changes. I'll be so bold they will watch in amazement.
Am I gonna face it? Am I gonna chase it? Am I gonna start or will I keep waiting? Time is limited, quickly fading. Get my mind right, it's my time to take it. Am I gonna face it? Am I gonna chase it? Am I gonna start or will I keep waiting? Time is limited, quickly fading. Get my mind right, it's my time to take it.
Foot up on the pedal, pushing hard to the metal. Make a deal with the devil. Channel rage through my vessel into something that is special. Energy of a rebel, going up a level. I just wanna be greatness. I could feel changes, turn a new page and tie up my laces. I will be the bravest, break out of my cages. I will not be nameless, I will not be aimless.
Am I gonna chase it? Am I gonna start or will I keep waiting? Time is limited, quickly fading. Get my mind right, it's my time to take it. Am I gonna face it? Am I gonna chase it? Am I gonna start or will I keep waiting? Time is limited, quickly fading. Get my mind right, it's my time to take it.
What's up, everybody? What is going on? Welcome back to the Locked In Podcast. If you don't know who the Locked In Podcasts are, well, we're your hub, your personal home for personal development tips, sports news. We cover both here. If you're new to the channel, thank you for looking in. If you're not already subscribed on YouTube, make sure you hit that subscribe button and make sure you hit that notification bell to turn notifications on, because new episodes are released every single week. They usually cover some sector of personal development or some sector of sports. So you don't want to miss that if either of those two topics do interest you. I do want to welcome you to the channel. If you're an OG listener, you've been here for the long haul. We've been doing this about 4.5 years right now. So, thank you if you've been rocking with us since the beginning. As always, what we're talking about tonight's episode 198. And you might ask, what are we talking about? Well, we're talking about personal development again. But personal development, what I mean by that is what we're talking about is something actually not related to essentially goals or anything like that. What we're talking about is mental health. Mental health is very, very important for a number of reasons. We've covered it a few different times here on the podcast, usually when it's Mental Health Awareness Month or Men's Mental Health Month. We have covered and brought up mental health. But we like to cover them, too, towards the beginning of the year. Around this time, during the winters, especially if you live in the sectors of the U.S. where you get snow, where it gets really cold, it can become a really, really challenging climate, challenging atmosphere for many, many people. There's a such thing as seasonal depression. And that pops up. It causes people to kind of struggle with their mental health issues. But there's a lot of different disorders and struggles when it comes to mental health. And there's a lot of things that you can do when it comes to maintaining good, sound mental health. There's a lot of different things. So that's what we're going to talk about tonight, essentially just managing mental health in 2025. I'm going to walk through, potentially with guests tonight, the different types of disorders that there are. There's a lot of them, but I'm going to walk through the most common ones. I'll give you guys brief descriptions on them. I do want to walk through coping mechanisms as well for some of these disorders. These are some coping mechanisms that I have found, when I have anxiety or certain types of things kind of going on that have helped me. These are also include some coping mechanisms that were recommended to me by people I know that are in the mental health field, and some of the ones that I've researched. So let me add on here. Hey, Leyla, what's going on?
Not much. Just got home. How are you?
Good. Welcome in. Thank you for joining.
Yes, I was determined to make it this time.
I appreciate that. And I see you have the your Eagle shirt on there. So
We're bleeding green till Sunday, and
yes,
depending
we are.
on Sunday, I might disown them. So let's see.
Yeah, they definitely should win. I think they're going to pull it out against the Rams. We beat them pretty soundly when we played them the first time. And I really wanted this matchup because, honestly, I don't think the Rams ever match up well with us. It's always in our favor. So Sean McVay never matches up well with us. So
Yeah. I just don't want to be disappointed.
I know. You don't want to get too overconfident, right? I had to wait and see until, the end of the game, until it's 0 on the clock, and then I can celebrate.
Yeah. So what's going on? How's it going?
What's that? You said, how's it going? Then you kind of cut out just for like a second.
Yeah, so what's going on with you? How's it going?
Good. I just was interested to kind of talk about this topic tonight because it's like that time of the year now where a lot of people go through like different types of, it's only one type of disorder, but seasonal depression is a big thing around this time of the year. It's the beginning of the year. So I always like to cover this type of stuff, but yeah, podcast is going well. Things are pretty good. Obviously, I had a little bit of a loss in my family last week.
Yeah, I'm so sorry to hear that.
Yeah, that was a little tough, but hey, we're getting through it. But,
yeah, January is definitely a general month for everyone to try to reset or press that reset button.
Yeah.
And there's some type of motivation in there, I guess. Everyone's doing it at the same time.
Yeah. Everybody has like that New Year, New Me motivation
Right.
and stuff like that.
Right.
And when the motivation kind of goes, that's when like discipline kind of kicks in, and when it becomes, I feel like, the most challenging. There's like a certain day they say where most people give up on like their New Year's resolutions.
Gave up already.
Yeah, I think it's by like the 10th day of the month or something. So, but if you've already, I'll say this to anybody out there: if you're still kind of sticking to your resolution so far, you're probably beating majority of people, because they usually say I think it's the 10th day into the month where most people kind of quit the resolution. So obviously the gyms flood this time of year. Most people trying to change their habits and everything, but
yeah, right now
I think the most important thing is
my phone lines are kind of going off right now because everyone's trying to get their mind straight.
Yeah. Actually, like, I don't know if I've told anybody on the podcast here, but I kind of looked into just doing some just personal therapy for myself this year. Something I never ever really looked into, but I personally think anybody can kind of benefit from like different types of therapy. It really doesn't matter how well you feel in life and different things. I think people can benefit from it, and it was something that I had obviously spoken on the podcast and stuff, but never really went through it. But so I had to take a step and just go through it, because there were a couple different areas of my life that I just wanted to improve. So I just wanted to talk to somebody about it. Yeah.
No, absolutely. And you know what? The hardest thing is to look yourself in the mirror, and but the positive side is to you're learning something new even about yourself, and it's it gives you gives you a little bit more of a challenge. And yeah, I recommend therapy to everyone. I wish my family would do it, but I'm trying to break that generation stigma, I guess.
Yeah, same. I agree. Like, some of my family, I doubt would go do it, because and it's how we are sometimes, right? We're creatures of habit, and sometimes we're very, very stubborn. We don't want to we don't want to be vulnerable, because therapy
It's really hard.
it takes a little bit of vulnerability. I'm not gonna lie, like I'm not typically like a nervous person, but I was a little nervous like hopping into my first session and stuff like that. But once you kind of go through it and you start to you have like somebody good that you're working with, it actually becomes really comfortable, and it actually becomes something
Absolutely. And it's good to have like a third, like an outlet, like a different outlet than just friends and family. This is someone that doesn't know you at all, gives their honest opinion. And yeah, and I personally love therapy.
Yeah, I agree with you there. I think the neutral outlet is important, because a lot of people that are like close to you, they may sugarcoat stuff because they don't want to hurt your feelings, or they don't want to I don't know, they kind of walk on eggshells. They don't want to maybe tell you the exact truth. So like that's the thing, and that's why I think it's good to have a neutral outlet, somebody who does not know you. Yeah. Because people around you might not honestly tell you the truth. So yeah, I agree with you. I think anybody can benefit from therapy. So guys, if you're thinking about it, I would say just go for it. And it might take you a little while to find stuff. Yeah, it might take you a little while to find somebody that you're comfortable working with, but
100%.
don't give up.
And that's a deal breaker sometimes, but I definitely agree.
Yeah, don't get discouraged. There's a lot of people out there that can work with you. So towards the end of this show, I'll give you guys some resources, and I was just gonna on a general level talk about mental health management, walk through some of the common disorders briefly, and then some good solid coping mechanisms. Sure. And then towards the end was going to kind of go to the resource route. I know you actually have a great resource yourself, so. Every time I do an episode, since you've been on that one time, I think you were on the first one we ever did on here. I always recommend where you work. Research. So.
No, I honestly, that's like a highlight. Even just like talking to people on the phone, even if they don't make an appointment, or like it's just such a rewarding job. Just to even like de-escalate, like that's maybe what they needed at that moment. And it's just such a rewarding job. I love it.
Yeah, most people I know that are like in that field, they exact same way. They love it because it's you're providing relief to somebody who really, really needs it, and that's an amazing thing.
Yeah.
So I and kudos to you for the field that you work in, and like everything you on a regular basis.
Yeah, I mean, they say you got to be crazy to understand crazy. I'm just kidding.
Hey, we've all gone through some stuff, right? And I think that's life is hard, right? Life is difficult. We all get through some shit, and everybody's journey's different, and the level of different things that people go through. But it makes us everybody can relate to different things.
Yeah, for sure. So I guess where do you want to start?
I guess I could start by just briefly. I'll walk through some of the common disorders that people face. And then I have some notes here, but nice. I'll just walk through. And I wrote a lot, so I won't just describe everything in here, but I'll go through some of the general disorders here, and then we could talk a little bit about that and go from there.
All right.
All right, guys. So some of the disorders that people deal with, these are the common ones. Obviously, there's a ton of them. I'll walk through the most common ones. We've talked about a lot on this podcast. Is depression is one of them. So I'll walk through the names, and then I'll kind of go back to the first one, and then work my way through. Another one is generalized anxiety disorder or anxiety, panic disorder. There's OCD, obsessive compulsive disorder, PTSD, which is post-traumatic stress disorder, and then social anxiety disorder is another one. And they all kind of have their own unique. Even within each other, there's different breakdowns, but I'll go through on the general level. But depression, we hear that word a lot. That's one of the most common words we hear, depression and anxiety. We talked a lot about it on the podcast before, but mainly depression. It refers to a wide range of mental health problems that are characterized mainly by the actual definition is by the absence of a positive effect. It's usually described as like a loss of interest, enjoyment in ordinary things and experiences. It can be something like low mood, a range of associated emotional, cognitive, physical, behavioral symptoms. And there's different types of depression as well. There's a lot of different
Absolutely.
there's a lot of different things that go into it. Like we said, there's seasonal depression, there's situational depression, there's
Yeah.
yeah, actually clinical depression. So there's a lot that kind of goes under that umbrella. But some of the symptoms of depression, there's behavioral and physical ones. Some of them include tearfulness, irritability, social withdrawal. That's a big one. Exacerbation of pre-existing pains. There's pain
Yeah.
secondary to muscle tension. There's a lot of physical things that come with it too. But
Absolutely.
yeah,
And I actually just
yeah,
like witnessed someone, like a patient, where they had this like pain, like this like chronic pain, and he went through extensive testing, probably seen every doctor under the sun, and almost everyone, is saying like this is kind of exacerbated by your mood, and it's anxiety. And it's so hard to convince someone to believe that, because at the end of the day there's a stigma, and you know it's it's hard to kind of, what's the word I'm looking for, I guess. Nah, I don't know how to describe it, but this gentleman, he had so much pain, and eventually he did the traditional medication, and I think I mentioned we do ketamine at my office.
yeah,
So after like even like 2-3 rounds of ketamine, like he was a complete different person. Like he would say himself, like, I feel a little bit better, I feel like a little bit lighter, and like I'm not having that much pain. And it's so remarkable because it's so hard in general to recognize those patterns and acknowledge it, where like this medication kind of like is kind of breaking that barrier and saying like, okay, I'm okay, and then your body kind of is able to kind of relax and not go through that pain.
yeah. No, that's really really remarkable. Yeah, you said I know you've spoken before that they do ketamine treatments at your office, and I think I don't know if you remember my buddy Bill actually went
Yeah.
through a whole metamorphosis with like ketamine, and he did like where he went, and I remember he said like he did like 4 or 5 sessions, and he said when he left for like the third session, he was actually in a really really low state. Like it kind of
It's
put him
so
into like a
true.
crazy state. Yeah. And then it brings you back up
It
like
does.
by the time you're done, which is yeah. He
In
went into
fact,
like
better
great detail.
yeah. No, that's
Yeah,
absolutely
yeah,
very common, and I think people should be careful because some people do it illicitly. Psychedelics, for example, are done illicitly.
yeah.
Um, and they all kind of have like the same components because they work on the same receptors of the brain. They work on the
Right,
NMDA receptor. So it can, it seems to be like the pattern being like, okay, like they're already in a low space, and it's like a little kind of hope, and then they go in a dip, and they're like, oh my god, I'm so, like, they get so discouraged, they don't want to do anything anymore. But I usually try to encourage people to push through. They're still going to be here one way or another, so let's at least try. And most likely it does type kind of go back, it does end up going back up, and they kind of stabilize and feel a lot better.
right. That's awesome. Would you say like you think like most of the people that kind of go through that at your offices they benefit from it? Like if
Absolutely.
I guess yeah. I guess it depends. What if you go through like ketamine, do you have to like have like certain types of conditions to qualify to like go through that, or like how does that
Yes.
work?
So usually it's not recommended for bipolar disorder. I do know people
Okay.
who do it, but you have to be like closely monitored, and you have to really um, just track your mood. So you're just like not jumping into like a manic state. And also people who are in active psychosis, so seeing, believing, or hearing things that are not real. Those are the two things that would probably disqualify you. And also if you have
Okay.
like a pre-existing heart condition.
Okay. I can imagine that with like the pre-psychosis and stuff, like because it could probably exacerbate it, especially
Oh,
when you get to like the low
100%.
sleep. Yeah, it can make it, like even worse for sure. I
Yeah,
can
and you don't
imagine.
want to do that. I know it sounds fun, but please be careful.
Yeah, and if you take it on the recreational side outside of a controlled environment, be very very careful because I know some people that have, but like yeah, when it's not a controlled environment, I feel like it can get very very dangerous. I've
Yeah.
never done that, so
So in our
yeah,
office, it's like in a comfortable setting. So you're not like having people going in and out. You're not sharing a room with a curtain in between you. We make sure like you're in a reclining chair, you have some shades, you can either have your own playlist. We usually put our own playlist. It's like very neutral instrumental music. Um,
yeah.
what was I gonna go? What was my point for all of this?
You were saying it was kind of like
Oh,
we were kind of talking like
yeah.
controlled
No,
environment. Yeah,
exactly. And that can like completely make or break the situation. Like if you're doing it with like a bunch of buddies, like it may not turn out the way you expect it. And it could be dangerous.
yeah. I can imagine. I've heard about that chair too. The chair that like because Bill was telling me how it's like a certain like inclined chair that you kind of lay in
Yeah. Oh,
as you go
and then
through
we
the.
have a weighted blanket too. I love the weighted blanket.
Okay. That's cool. Yeah,
Yeah,
I weighted blankets are really comfortable. Makes you kind of not want to get up if you have one like in the morning.
exactly. And it
Um,
makes them feel secure. It feels I guess feels like someone's coddling them, So it
yeah,
really comforts people doing the ketamine because you can get super anxious at some points. So it can kind of like really just make you relaxed.
right. Yeah, I can imagine. I mean, that's important too. The person needs to feel, I think, comfortable for sure.
Yeah.
Um, but going to the depression side of it, like I was saying, there's a lot of different things that kind of go under the depression umbrella. But some of the common, even with all the different types of depression, some of the other common symptoms can be typically, I've seen this in people I know that battle depression, typically reduced sleep, lowered appetite, which can result in significant weight loss. I've seen that a lot.
And
And
the
then
complete
some people,
opposite, you can just wait.
yeah,
The
weight
complete
gain too.
opposite.
Yeah. Yep, you could be weight gain, or you could also sleep more. You could oversleep. That could also be a sign of
Absolutely.
depression. Yep, that people don't look at. And mainly just a loss of enjoyment in everyday life. I noticed, some people they struggle to like the things that they actually typically enjoy. Like maybe at one point they were things that they really enjoyed, and then they kind of lost their actual enjoyment of those things. Lowered self esteem can be some things, loss of confidence, feelings of helplessness, and then on a really, really deep level, suicidal ideation or attempts at like self harm are things on the extreme scale, on the extreme side of it too, that can lead to if not treated. And like I said, there's different types. There's clinical depression, which can be like actual like it
Ongoing
can be
for the rest of
diagnosed.
your life.
Yeah, ongoing, right? And there's certain things like everybody's situation's different, but some of the things that I've seen with that are obviously people, have take antidepressant depressants that work for them and help them kind of function. And I know some people that do have clinical depression. I also know a couple people, and I think this is a common one, situational depression, which is maybe you're at a low point in your life, say you got fired from a job. Maybe your living situation changed. Maybe you were in a relationship or a marriage and you went through a divorce, or you a loss of a loved one, or it could be anything. To be honest, could put you in a state of situational depression where you're at a really really low point of your life. But that's different from clinical depression because situational depression, typically when you start to get back into a situation where you're in a better spot. Say you lost your job and you find a new job and you're making money again, or say you went through a divorce but then you start dating again and you eventually get
Like
into
you still have some type of motivation and
exactly
motivation, whereas with depression, you really don't feel like doing anything at all.
right.
The cup
Yeah.
is half empty. You have a negative outlook majority of the time, so it's more chronic.
Yeah. Yeah. You could be a multimillionaire. You could be surrounded by a bunch of people to love you, and you could still be in a state
Absolutely.
of depression. So it's definitely different. And then seasonal depression is something that a lot of people I know will go through typically in the winter, the darker months. Obviously, the days get, at least in where we live, right? The northeast sector of the U.S., where that we get all 4 seasons here. So it can get cold, and then obviously we get the shorter days with daylight savings time, and that can put people kind of in a funk. Not as much sunlight, especially if they're people who like go to work, right? Like they go to work when the sun is not even up yet, and then by the time they get out of work, the sun's already set. So it's like you're not getting a lot of sunlight. It can definitely put people in a weird kind of put them in like a weird feeling. Yeah. What did you say?
And like if you have decreased vitamin D can also make depressed. So for example, like you were saying, situational, maybe you're all, like, and it's combined, right? So let's say you're going through a hard time, plus your health may not be in the place you want it to be. So say you go to your physical, get some labs drawn, and you see your vitamin D is extremely low, then it's like, oh, okay, well, this kind of makes sense. And there's times where you go on a supplement and you get back to normal. And that was the only thing that was kind of holding you back, which is remarkable.
Yeah. Sometimes it can just be that was the keeping you low. You just needed that one little thing to kind of put you back into like, your normal state where you're feeling great and ready to
and like with vitamin D, like you'll have like chronic fatigue, so like easily confused with just depression, so it can be easily treated, and that's like one of the most common not reasons but ways people suffer from depression.
Yep, absolutely. There's also GAD, it's generalized anxiety disorder. It's also just known as when people say like they have anxiety. Mainly this is something that sometimes people kind of confuse. Like they say depression, anxiety, and then they kind of confuse the two. It's a little bit different for both. So generalized anxiety disorder or anxiety, it's excessive worry occurring on more days, and they actually describe it as not for a period. On more days than not for a period of at least 6 months. It's about they say a person with anxiety typically finds it difficult to control their anxiety and worry, and it's often accompanied by restlessness, being easily fatigued, having difficulty concentrating, things of that nature. The focus of anxiety is not confined to the features of another disorder, so it's very, very general. That's why they call it general anxiety disorder. So for example, one of the examples I have here is having panic attacks, as in panic disorder, or being embarrassed in public, which is typically like social anxiety disorder. So it's not confined. Those are kind of features of those disorders, but anxiety is just more general. Some people can be excessively apprehensive of the outcome of routine activities. So there's a lot of it's very general, but there's different types of anxiety disorders too. Just as there's different things under depression, like we said with anxiety, there's the things like social anxiety disorder. There's different types of things under that umbrella as well.
Say hi to Nova, everybody.
Hey. He's cute. Cute little pup.
Thank
We have. Let me go through some of the. Yeah, so I would say anxiety. Yeah, anxiety is very very general. It can be a lot of different things. Whereas depression, it's usually things are a little bit more specific. If I go to the two.
And with anxiety, I feel some things that happen that occurred when you have anxiety is that I lost. See, I have ADHD. We can, but
I do too a little bit, to be honest. So
sabotage. So
I
like if you
understand.
something, so you may put yourself in a situation where, for example, like if you have a test and you're constantly worrying about the test, but you're doing everything but studying for this test because you're just so worried, right? So, and then essentially you're self-sabotaging. So that's what it can look like in a normal person's
Yeah.
life, not being even realizing you're having. You just
Yep.
feel
Absolutely.
will say like either like you're lazy or you just don't want to do it. No, I mean it's a legit thing. People really do struggle because they just feel stuck.
Yep. And it definitely can come out as self sabotage, procrastination, different types of things, and then it kind of snowballs into more anxiety because we
Oh
kind
yeah.
of tell ourselves, yep, and then when we self sabotage, we tell ourselves that, hey, look, we might have that negative self talk where we're telling ourselves, see, you're too stupid, you can't do that or whatever, but yeah, no, it that can definitely be one way that anxiety definitely looks absolutely. Um, There's also other ones too that are very common that I'll walk through these last three really quickly. So there's OCD, it's obsessive compulsive disorder. I'll go through the definition and I'll kind of give an example. So it can be defined as an obsession. It can be like an obsession as an unwanted intrusive thought, image, or urge that repeatedly enters a person's mind. OCD can look at something like if you're really anal about cleaning certain things, then you want your house to look super spotless, but you take it like over the top. Like it's not just like standardly cleaning, like it needs to be that's just an example. Like you have to overly scrub or clean your house. Like every little speck of dust is gonna bug you or make you really uncomfortable. That's just one example. Some people can be with viruses, germs, overly clean where they're constantly scrubbing their hands. Can be an example. But just things like that. That's considered like OCD. It's like an example of it. I'm sure we've all seen that, or maybe we felt with ourselves. And obsessive compulsion disorder can vary in the level of actual degrees. I would say some people can have like extreme obsessive compulsion disorder, and other people might just have very minor obsessive compulsion
And
disorder.
I would like say that I could present, like you said, intrusive thoughts. I
Yeah,
mean, I think the most common thing is like cleanliness and being so uptight about, but OCD in general is a very extensive disorder. So one with like intrusive thoughts, compulsions, and obsessions. So this could be like you tap the doorknob 5 times before you leave and say you're rushing. You cannot, and like they're literally unable to pass the door without touching that doorknob 5 times. Like even if they're like 10 minutes late and they're about to get fired, they have to touch that doorknob 10 times. It doesn't make
yeah,
sense rational to them, but at the end it's a control thing because they control something and it ends up being like an obsession and a compulsion. As for like intrusive, would be like intrusive thoughts. For example, I had a patient where it sounds silly, but they just think about a knife and like thinking like, oh well, what if I just like hold that knife? And you know what I mean? It's just so irrational, and like it could be their daughter next to them, but
Yep.
all I think about is that knife, right? It's just
Hmm.
ridiculous, and not necessarily are they like crazy, and they're gonna act upon that, but it's just that thought that just will not leave it no matter what. And it's a very bizarre condition, and it's one of the hardest conditions, I would say, next to like schizophrenia. That's kind of
Yeah.
hard. Um,
Yeah. That's a great breakdown of it, to be honest, because most people, they just say, "Oh, you're OCD." When someone's like does something like small, like people like don't actually think. Yeah, those intrusive thoughts. They kind of are the driver. Yeah. Yeah.
there's
It's almost as if like say like something about cleaning. Like if I don't clean that, like your whole day's gonna be ruined. Like if you don't scrub that spot or touch it's almost as if your day cannot continue until you do it, and it just will throw your whole day off.
trying to convince them that like, hey, like if you don't touch that or do that, like everything's gonna be okay. And it's like, okay, but it's like they have such a hard time even convincing themselves. Like they clearly know the truth, but it's
Yep.
something that and it has to go deeper, I think, to maybe childhood, with
Yep.
maybe self coping mechanism where they have a control. Say, for example, a child could have been in a household where it was unstable, um, and the only thing during that time that made them feel happy is maybe tapping, right? So like tap tap tap, and now like they
Yep.
can't, now they're an adult, 40, and they can't leave without the key.
Yep. They never ever really, and that's the thing. It's sometimes it takes so long, and they can go through their whole life that way if they don't decide to seek help for it or anything like that. They
Because
can definitely
it's
start.
for what's that word, like something that it's like developed in their core almost, so like it's like a binky in a way to them.
Yeah, it's like yep. It's almost like a security like blanket for them. Like it's a sense of security. It's kind of how it's looked at
And
for sure. Um,
it can be
and
different,
unfortunately,
I
yeah,
would
and
say.
unfortunately, there's. Oh, sorry, I was gonna say, unfortunately, those compulsions can definitely like ruin relationships with people as well. Like it can be, because even healthy habits, overdoing anything, can be bad. Like if it becomes to an obsession, where it's even the healthiest habits, like I don't know, anything can too much of anything can be bad.
Fun is the way to and that's hard too,
Yeah,
but trying to find a balance is the only way that's gonna not make it go off the deep.
yeah, absolutely. The last two here that I'll walk through real quick are PTSD. I'll start with that one, post-traumatic stress disorder. So PTSD, this ultimately develops, it often develops as a response to traumatic events. Um, these traumatic events can result from things such as acts of interpersonal violence, severe accidents, disasters, or another common one, or people who have served. It could be military action as well. Those at risk of this disorder include survivors of war and torture, um, accidents and disasters, violent crime, could be physical, sexual assault, sexual abuse, also from like childhood or just even adulthood, bombings and riots, refugees. Maybe it could be women who have experienced traumatic childbirth. All different types of things can kind of be the result, can provide the result of PTSD. And some of the symptoms that kind of go along with the most characteristic symptoms of PTSD are re-experiencing symptoms. So people with PTSD, they involuntarily re-experience aspects of a traumatic event in a vivid and distressing way. That's why some people will be like, "Oh, I have like." Sometimes people make like jokes about it, but it's actual serious disorder. They'll be like, "Oh, I had PTSD," because they relived like a deja vu type of moment of something that they went through. But symptoms of this disorder include flashbacks, in which a person acts or feels as if the event is recurring, nightmares, repetitive and distressive, intrusive images, or other sensory impressions from the event. So it can almost be like reliving that traumatic experience that they went through, and that's kind of how PTSD kind of acts itself out. Like that's kind of how that is experienced in a way. It's from a lot of trauma.
How it affects how it affects them different. I it I usually describe it as a tolerance in a way. So everyone's trauma is different. So someone's PTSD could be falling and slipping, and they hit their head, and they had a TBI, traumatic brain injury. And
Yeah.
someone theirs could be like you mentioned, going to the war. But you're like, okay, well, how can two people have different type of traumas? And some people may not consider, let's say, slipping and falling a trauma and getting hurt, but it kind of goes back to the person's tolerance. So what I can tolerate, and this could be you are grown, you guys get raised in a house, right? But maybe
Yep.
One person or sibling is struggling more than the other. They live identical life, but maybe I don't know, the Halloween party was scary, and and the one sibling was scared than the other, so now they can't go into a Halloween attraction, for example. I mean, that's just super super mild, but that's just kind of going back to the way they tolerate things. So we have two people lived almost a complete identical life, but one person can tolerate something and the other one may not. So and this kind of goes back to not everyone that goes to war has PTSD, but maybe
Mm-hmm.
that is suffering from PTSD has kind of a lower threshold in a way, right? So and
Yep.
fact that everyone's trauma is different, and how it kind of presents them is different. But yeah, I think that's pretty much how it affects with the person's tolerability, kind of how I explain it.
Yeah. Tolerance is a great way to put it, to be honest. It's a great way to put it. Like you said, everybody's tolerance is different. So just because somebody and that's the point of it. Not all PTSD has to be something as crazy as or debilitating as going through being tortured to the level of where you have PTSD. It could be something like you said, as simple as a slip and fall. Yeah.
Constantly.
Yep. Yep. Exactly. It can be, something as little as that. But yeah, it's all about that tolerance for sure. The last one I have here is SAD. It's social anxiety disorder. This is kind of under the umbrella of anxiety. Like I said, kind of like depression. There's all different types of anxiety disorders. This is a very common one, and this is something I've seen among people I've known. You when you get older, you kind of realize you start to people tend to you don't really understand it as much when especially if you don't go through it when you're younger, but then as you get older, you're you kind of I have some friends that deal with this for sure. And it's ultimately referred to as a social phobia. It's characterized by an intense fear of social situations that result in considerable distress. And in turn, it impacts a person's ability to essentially function effectively in aspects of their daily life. So it's mainly a fear of being judged by others, being humiliated, or embarrassed. It can lead to an avoidance of certain social situations. which can definitely impact their life.
Able to enjoy anything.
Yeah. And it could be something as simple as, going to the grocery store. Like somebody doesn't want to go to the grocery store or walk inside because they're just, I don't like, just even like an interaction, they fear like, embarrassing themselves or, saying the wrong thing, maybe to the cashier when they're checking out, or it could be something as simple as that. So instead, maybe they decide to, not just for the convenience aspect, it's just because of the social anxiety aspect, maybe they do like Carside to Go because they just want to avoid that interaction.
Luckily, we have options. We used to not have those options.
I know back in the day, that wasn't even a thing. Now with COVID, like when COVID passed and everything, like there's so many other options to be able to do things. And now you have, now you have like Amazon and like all these other places. You can literally just get your groceries delivered where you can kind of avoid it. I would say to try to, that's how you kind of know, like if you're avoiding it, maybe you're avoiding it if you're avoiding it because of the disorder, there's different ways you can go about it. I'd say like challenge yourself maybe in those environments, which can be tough. But it's also not always that simple, but
for social and like our body craves it. So you can isolate yourself all you want, but after a while, you're going to even have like cognitive impair after a while from isolating yourself because you don't know how to interact with someone.
Exactly. Sometimes you have to kind of push through that fear with social anxiety to be able to, and it starts by like small steps. It doesn't have to be anything like crazy. Like maybe you're somebody who, it can be like, maybe you're somebody who doesn't like being in a room with a ton of people. So it's like, you don't like going to parties with like 50 people or a bunch of people, and you'd rather be something more low key. Or like I said, it can be something as simple as you don't want to go to the grocery store in fear of embarrassment and stuff like that. But those types of things, I would say, to kind of, like you said, we're social creatures, right? We're social creatures and we crave interaction. We crave that. We crave that human element. And eventually isolation is just going to lead to a whole other list of things. So, but I'll give you guys some of the physical symptoms that kind of come along with this too, so you can kind of notice it. Excessive blushing, sweating, trembling, palpitations, nausea are some of the things. Panic attacks are also very common. Alcohol or drug misuse can actually also develop because people use these substances.
And depression, anxiety, psychosis. We'll get into substance use after this one.
Because that can come with that doesn't just come with this disorder. It can come with a lot of different other disorders, kind of to try to cope and mask in an unhealthy way. Because there's positive ways to cope, but then there's also very negative ways to cope. So those are the most common ones. So like I said, depression, there's different portions of it underneath of it, generalized anxiety disorder, OCD, PTSD, and then social anxiety disorder are some of the most common ones. And now there's also a lot of solid coping mechanisms that you can use for each one. Some of these can kind of work for all of them. Some of them maybe just for a few. But these are some of the healthy coping mechanisms that you can use. Like we said, we'll also talk about maybe some of the negative ones like drug use, alcohol abuse, different types of things. They can be negative coping mechanisms to kind of mask what somebody is going through. But
gambling.
Yep, it's another one. Yep, absolutely. So one of the two of the physical ones that are really, really good coping mechanisms is one of the most obvious ones that people will probably tell you is exercise, and it's for good reason. It's because it's not just about losing or gaining weight or losing weight or building muscle or anything like that. It can be really good for your mental well-being. I know for me, like, I go to the gym for the physical side of it, right? But also mainly, I'm not going to lie, for the mental health side of it, because
our brain excretes chemicals
Yeah.
that happen when you are exercising.
Yep.
If someone's like, okay, well, like, I don't want to take a pill, I don't want to do this, and then I don't want to do side effects. Okay, well, the next thing would be exercise for sure. Like, that is like number one. And each person, and keeping that routine obviously is going to be hard, but if someone is able to push through, they 100% will agree with you. In the beginning, it's hard to make them kind of believe that, but once they kind of see the outcomes of it, looking good and feeling good on top of that, definitely helps a lot with any type of mental health disorders.
Yep. Fueling our body correctly for sure. So, eating, well-balanced meals, nutrition, we tend to feel more like garbage when we eat garbage, to be honest, and we're all guilty, everybody's guilty of it. It's so easy nowadays to just hit a drive-through, definitely guilty of it myself here and there. It's so easy to do that. But I just noticed, when I eat healthier and, I'm eating more balanced, nutritious meals, I not only feel full, but I also feel I can think a lot clearer. I feel a lot better. So that goes hand in hand with working out, getting sunlight, drinking, making sure you stay hydrated, with water, things like that. Yeah.
Sleep is so important.
Yes. So that's the thing that's important too. Working yourself to death, and you're only getting like 3 hours of sleep a night. It's not healthy at all. It's crazy though. Like, I actually know some people that are in their 40s, like my mentor, he can sleep like 3-4 hours a night, and he is like so energetic and well refreshed. But for him, it's always been that way. Like, I don't know. Like, some people are different. But I'm gonna say right now though, like, if you work out regularly, especially like if say you lift weights and stuff, you need time to recover. You need to be able to make sure you're getting proper sleep. Yeah.
Go. Like,
yeah, you're gonna burn yourself out.
Please take a step back.
Yeah, you're gonna burn yourself out. Like, and that's the thing. Some people might be like, "Oh, I still feel great off 3 hours of sleep," but then they really don't.
Like, people with bipolar disorder, they love their mania. It's like their Red Bull, right? Like,
yeah.
Like, I know a lot of people, but there's pros and cons. Obviously they're trying to get treatment for their bipolar because now it's affecting their life. Let's say impulse control. That's one of the things. Not sleeping, just doing a bunch of things. So, I lost my train of thought again.
That's right. You were saying they like their mania, like bipolar.
Oh yeah, and then they come in, they get some relief. They get, they're gonna be put on medication, and then they kind of get back into like that stable mode, and they're like, well, I'm not getting anything done. And we're like, well, you don't have to. That's not normal.
Exactly. Yeah. So it definitely, yeah, it's like, so if you're not sleeping, a lot of different things kind of go into it. Take a step back for sure. You need to be able to refuel your body. Your body's like an engine, right? You want to fuel it correctly, but you also need to refuel and recover with rest. There's a lot of deep breathing exercises you can do as well. Another big word a lot of people like to use is meditation as well. Meditation is like one that people, I think, tend to think that when somebody's meditating, they're sitting on the grass on a mat, just with their eyes closed doing all that. Meditation really does not need to be too complex. To be honest, everybody meditates differently. There's definitely free apps out there that do guided meditation, but there's also meditation can be as simple as just sitting in your chair on your break real quick, at work, for 5 minutes and just closing your eyes and just making sure there's no distractions and just really, really going into deep thought. So essentially just being mindful, people, yeah.
Relaxing.
Yep. Being able to kind of get into deep thought and really be able to focus on being able to focus on your thoughts, being able to kind of feel the sensations in your body. Yeah. So that can be helpful, mindfulness for sure. Another one is positive affirmations. And a lot of people might not, agree, believe in this, but sometimes honestly it is. It can just be something as simple as repeating affirmations to yourself, that can make you feel more confident. Just honestly, sometimes just saying things out loud, positive things about yourself, can honestly make you feel more confident. It can give you kind of a mindset shift. But
Absolutely.
yeah, and just it kind of, if you're someone who has a lot of negative self-talk, I think that this can definitely help combat it, right? You kind of fight it off with that positive self-talk, and then that kind of can take over. So I think that can be really helpful. I know a lot of people that's really been helpful for.
No, I 100 agree.
Yeah,
And what I kind of say is like, fake it till you make it, right? So, and there's no harm in that. If you, and then another um, saying is, you look good, you feel good. So those, like, just making those little small, like affirmations. Oh, I look good today, and then you kind of making yourself feel good, right? Just those little things can really make a difference. And um, another thing that I like personally are some self-help books.
yeah, that can be helpful too. I like listening to some good personal development books, like here and there. Like I have Audible. Sometimes I like to read, actually, like physically read, but sometimes if I'm on the go or something, I'll like listen to. I try to do it like if it's something like maybe when I'm driving somewhere, but also I could just be going for a walk or doing something where I can kind of just like dive into like what I'm listening to. But Audible's like, it's not a free app, but there's also free apps out there as well. But Audible is a paid one, but you can get really, really good audiobooks that you can keep once you get.
I got new. It's not. I don't know if it's an app, but it's extension on my desktop where
Okay.
it reads it. So like when I'm in, if I have something like a reading material, I personally hate reading. I'm a more listener.
Yeah.
So it's called Scribe. I don't remember what it's called, but it reads it out loud for you,
Yeah, I think
and
I've heard of that before. I think I've heard of that.
it
Scribe.
makes my life so much easier.
Yeah, for sure. Like here and there, like sometimes I like to like I'll read, but to be honest, I agree with you there. I am more of a listener. I like to kind of listen and kind of take in everything. Um, I'm the same way. Like especially if it's something that like I know anytime I was in school and I had to read something, it wasn't something I wanted to read. Like it was like I'd have to like reread like this stuff like a second time, like to make sure I got it. Unless it became really interesting and I could really dive into it, but kind of be a struggle. Um, some people also tap into like some of the other things I have here. If you actually like to tap into your creative side, some people like to draw and paint. Um, I'm not somebody who really draws or have ever really painted. But for some people, that's really, really helpful. Writing. I will say, like like for me, I like to journal like sometimes, so that can be a good thing too. There's music, reading, crafting. There's all different types of things. For some people, it can even be playing sports too. If you like to play sports to keep you active, but there's a lot of positive coping mechanisms. Some of the negative ones can, like,
Great.
what's that?
I said you mentioned some great examples.
Thanks. I don't know if you have any more to add to that. Like, so some of like the positive coping
I
mechanisms.
think you nailed it. Definitely what I would recommend is, there if you're having a hard time, I recommend definitely reaching out to someone. I one resource usually recommend psychologytoday.com, where you can see therapist profiles on. You can kind of filter out like specialty, male or female preferences like that. So I like using that website, and and also feel free to even give me a call at Thalia Medical Center. Talk to you for kind of get it out and
Yeah, that will.
um That's really kind of, I would say, like good coping mechanisms, being aware, going to therapy, um, and definitely staying connected.
Absolutely. I'm gonna put this on the stream here. Here, let me take the little take this down real quick.
So not only do we, mental health disorders, but we also specialize in substance disorders, in dual diagnosis, which is having like both. And we kind of describe it as like, what comes first, the chicken or the egg? Are they using substance use to mask their mental health disorder, or is there mental health that wanting to use, or whatever the case may be? Um, I'm a strong advocate, of um, like substance use, harm reduction, um, and just being careful with what you're doing. Um,
Yep.
I would say you nailed everything.
Thanks. Yeah, and like I good point there too. Like with the negative side of coping, like the like alcohol, drugs, gambling, a lot of different ones. You just have to be extremely careful with that. Like even gambling now, everybody is like even it doesn't even have to be like casino gambling. Like nowadays, like people can even do things as sports betting that can turn into. Sometimes people don't even recognize like that it's a problem, but gambling can be one of those things that become very addictive. It's like an addict, and if you have an addictive personality, somehow you feel people don't always know that they do. That can become a serious problem. I've seen that become a problem for people. They start off with small like sports parlays and stuff, and it can escalate very, very quickly. Yeah, for sure. I did put the name of your medical center on there too. Dahlia. Is it Talia or Thalia? Thalia. Okay. Medical center, and that's in Montgomery County, right?
Yep. We're in Narberth, right by the main line.
Okay. Okay, great. Yeah. So guys, check that out as well. I also was gonna have my buddy Cory on here, but I don't think he's going to be able to make it tonight. But guys, he's a case manager in Montgomery County. Cory Bridges Cox. I will put his info in here too. And then if you guys need like his contact information or anything like that, I can send you guys a message. Just send me a DM, and I can get you in contact with Cory because he works as a case manager, and he deals with all different types of things as well. So for sure. And then that's what I mainly wanted to go through too at the end here. So let's hit the hour mark, but some resources. So we have I always mention where you work because I think that's a great resource. And the fact that they also do the ketamine stuff, I think that's kind of cutting edge. That's awesome that they do that. And I think that's how it came up the one time. I think my buddy Bill was on one of the episodes. I think we were all on there, and that's when we were kind of talking about it.
Yeah. Or talk, or just wants to learn about getting into treatment, I'll be happy to kind of guide them in the right direction, because most people don't really know where to start.
Yep, absolutely. I know there's seeing some of the other resources. I think I have some things bookmarked here.
I think the most common one is obviously 988. Everything ever becomes you're having thoughts of what other
Yep.
nearest emergency room.
Yeah, that's definitely a big one. I actually have that one as well. You said NAMI, right?
988.
Oh, 988. I was gonna say 988. Yeah, of course. That's the crisis line. Yeah, it's 24. Yeah, so you can always reach that. That's a 24/7 crisis line, guys. 988 for sure. That's I think the first and foremost. That's a big one right there. Another one I've heard of is they offer no cost mental health services is NAMI. It's NAMI, and they actually have a website. It's NAMI, NAMI, Philly.org. So you guys can actually reach out to that as well. And then another one that I've heard of, obviously, is the big one. I always see this one. It's SAMHSA. It's the Substance Abuse and Mental Health Services website. So they have it's this www.samhsa.gov. I will drop these actually in the chat for you guys.
Way you can kind of get started is like if you have like a established relationship, let's say with a primary provider.
Yeah.
That's also a good resource and say, hey, I'm struggling with this. Most likely not. They're probably going to be able to help guide. If they can't help you, they're going to definitely give you resources.
Yep, absolutely. Absolutely. That's actually a great first step. Yeah, if you have a primary care physician, for sure, they can probably link you to the correct sources too. Where you can kind of get your help and everything like that. And a lot of insurance providers nowadays, I love it. You just pay like your copay, you can get therapy now. That's a big thing. So definitely take advantage. And like I said, don't be afraid to jump to to take therapy. I feel like there's no harm in doing it at all. There's no hurt to do it. I really do believe that anybody can benefit from therapy. I don't care how well you think your life is going. If everybody struggles with different challenges in different areas of their life. So, if there's a certain area that you think you can work on, hey, do your research, try to see what type of therapists deal in certain areas. And, obviously, if you have insurance, check your insurance provider, see if they, line up with your, they're inside your network. And then, hey, schedule a consultation and see if they're a good fit. I don't think there's any hurt to that at all. It just requires taking that leap. And the more you're in therapy, you kind of get a little bit more comfortable with it as you go. So,
I feel like we're definitely in a spot where it's being recognized more. I feel like even like 10 years ago, it hasn't been getting the recognition needed, especially after the pandemic. It's really being talked about, awareness being brought up about it. And yeah, I think we're in the right direction when it comes to mental health. I'm kind of excited.
Yep, exactly. A lot more people speak on it now. A lot more people, you know what I mean? Whereas back in the day, it was, back in our parents' generation, it was just something that wasn't spoken about as much.
Oh,
It's
yeah.
kind of taboo. It was kind of taboo. I love it though that now, everybody's speaking about it because honestly, especially if there's people that are on, they're dealing with a really, really serious disorder where it could honestly lead to self-harm. I love that there's an outlet now for people. People are much more comfortable speaking on it. Yeah.
Like it doesn't have to be individual. If you're feeling alone and you feel like you need to connect, looking for that connection, there's group therapy.
Yep. Exactly. It doesn't just have to be alone. It's group therapy can be helpful because people that maybe be going through similar situations can all relate to one another, which is great. Yeah. And there's, like I said, there's all different types of therapy. There's one-on-one, there's group therapy, there's, if it's something relational wise, it could be couples therapy, there's all different types. So, a lot of people I know that are hesitant about therapy. Like there's certain people that I just know, you can tell, their ego's a little high. Like they don't want to go to therapy because they're like, they're just going to point out what I'm doing wrong or this. It's like,
well, that's something. What are you scared of yourself, sir?
Exactly that. Well, that's what it comes down to. It's like you're scared to be vulnerable. You're scared to be accountable. And that's the thing.
It is the key, 100%.
Yeah. And there's some people that's probably marriages would have worked out if they would have went to couples therapy and actually just sat down and addressed their issues. Because sometimes people struggle to work on, it could be in relationships too. People struggle to work on those things to themselves. It depends. Like if they went through a traumatic event together, say this is just an example. Say somebody went through a miscarriage or something. That's a very traumatic thing to go through. Sometimes relationships struggle through that afterwards. but then sometimes those couples might not be able to work on that on themselves, which is where couples therapy comes in. You're able to bring someone in who's a licensed professional that can kind of help you guys work through it. And that's the thing. Some people just have such high egos that they don't want to go through those types of things because they think, oh, well, they're going to blame me, or they're going to do I'm going to get blamed. It's like, no, you got to put your ego aside for a second and just understand that, what does it hurt to try it? That's how I say it. What does it hurt to try it? You're not losing anything by trying. You're not going to lose anything.
You might shut it.
Yeah. What are you going to lose? A $30 copay to your insurance? Oh, I lost a copay because I went through what are you really losing? It doesn't.
Exactly.
Yeah.
I would say challenge yourself, your thoughts, anything that you're doing, just question and just try to be the best version of yourself.
Exactly. That's what we should all strive for, to be the best version of ourselves. When we can show up best as ourselves, we can also help other people too.
Absolutely.
We have to show up as our best selves first, though. Take care of ourselves. That's another important thing. Sometimes people, and I've sometimes have been this way, people pleaser mentality. We always want to help other people. Don't forget to help yourself, though, too. That's an important thing because, we tend to, especially if we're givers and we're and we're always used to helping other people, we can kind of get burnt out doing that, too. If you're always helping other people, but you're not taking care of yourself, you can't show up as your best self for those other people anyway. So,
and boundaries,
Yep.
If you need to take care of yourself, don't be like, oh, well, this person do that. No, because if at the end of the day, there's maybe manipulation involved too. So if you're not making that boundary, and you're beating yourself up, eventually you're gonna get impacted.
Absolutely. Perfectly said. Yep. You have to be able to draw those boundaries. And you know what I mean? People might be upset at first, but it is what it is. You have to be your best self. So it's, yeah, exactly. What's best for you. So, like I said, you can't show up as your best self, if not. So you just have to, you don't want to get burnt out. You have to be able to, so do the small things, do the things that, are self-care. Do the self-care routines that are important to you, and make sure you take care of yourself.
Absolutely.
Very important. I think we kind of walked through everything. I don't know if I'm missing anything here. So went through resources, went through the coping mechanisms, and then went through the common mental health disorders that people deal with. Yeah, so I mean I think that's mainly what I wanted to cover here. As I have more resources, I'll probably usually through these weeks what I do, if there's a week where I cover mental health, I'll drop some resources on the Facebook and Instagram pages, guys. So you guys have other resources. Definitely check out Leyla's employer, Talia Medical Center if you're in the area. Montgomery County, as she said. You said it's in Narberth, right? Okay, yeah. So guys, if you're in the Philadelphia or outside area, definitely check that out for sure. There's a lot of resources, like we said, that you can find online. SAMSHA.org. You can also always hit the 24/7 crisis line if you need to get in touch with someone ASAP. You can dial that at 988. Obviously, if it's a serious emergency that you're going through, it's like a crisis, self-harm, anything like that, definitely make sure that you dial 911 for sure. If it's anything of that nature, but yeah, there's a lot of great resources. I'll drop them on the Facebook and Instagram pages, and then also, guys, Cory Bridges Cox. You can find him. Actually, he's not on social media, so I don't think he's on Facebook or Instagram or anything like that. But you can find him on LinkedIn. You can find Cory. If you need to get in touch with him personally, he's a case manager in Montgomery County. I can get you his phone number, and I can get you in contact with him. So I wasn't sure. He had kind of a scheduling conflict, so I didn't know if he was going to be able to make it in here tonight. But with that being said, we can kind of. My buddy Mario commented, and he said, "Good show, guys. Thanks, brother. Appreciate you. I know, this chat, for this new stream is kind of weird. Like, or this new platform is kind of weird. It kind of comes in as small, but you can also put it over there. Yeah, I'm kind of tampering with like a different. I don't know, like if you remember the last time we did it, I think it was StreamYard. So playing with like a different platform, just kind of look around. But hey, thank you for joining, Leyla. I really appreciate it. Go Birds! That's we got a big game on Sunday. I don't know. I feel good, but we'll see at the end. Hopefully they don't let me down. I don't want to feel sometimes feeling overconfident. Kind of. I'm like, I don't know. It kind of worries me.
I think not.
Feeling a little. Yeah. And then if they get to the next round, obviously, I think it's going to be Detroit. So that's the collision course everybody's been talking about all year for an NFC Championship game. So it might be Lions, Eagles. And that one, I'm not going to lie, that will be a very tough one. So, yeah. But hey, maybe in 2 weeks from now, we'll be talking about going to another Super Bowl.
Not wait.
We'll see.
All right. Broad stream just a few weeks.
Yep, exactly. Yeah, 2 weeks from now, we're going to be talking about going to a Super Bowl. If we do want to go to the Super Bowl, I got episodes for the next 2 weeks, but in 3 weeks, going into that Super Bowl weekend, I will definitely host a Super Bowl show. And if I wind up doing that, you're more than welcome to come. I'm sure I'll have a lot of people on for that. But yeah, if we go to the Super Bowl, I'll send you an invite. All right. Thanks again for coming on.
Yep.
Have a good night, good weekend.
Have a good night. Be well, everybody, and be good to each other. Have a good night. It was nice seeing you.
Absolutely. Yep. Nice seeing you too.
All right.
Go Birds.